Hey everybody, welcome to the Menolounge monthly series where we bring in our in-house experts, and today we've got our very special Dr. LaReesa. And when I was pinging Dr. LaReesa in our Slack, hey, what do we want to talk about on Thursday? She said ease and flow. Ease and flow. Hi there, Amelia. How are you? Hi, Bold Beginnings. And so when Dr. LaReesa said ease and flow, I immediately thought of progesterone. So she's going to hop on here. I know she is with patients, so we're going to be patient while she hops on. And I'll just give you a quick update. If you're looking for peanut butter, it's all on Amazon. Y'all sold us all out of the peanut butter from our fulfillment center, so it's all in Amazon fulfillment center. So that's where you're gonna find the peanut butter. And we're gonna have, actually this is double chocolate brownie, but we're gonna have blueberry all day at this really special event by Lavinia. I want to make sure I say it right. Erico, co-founder of Equinox, at her Spring into Joy event. She is in Malibu. So bars are everywhere. Thank you for loving them, eating them, sharing them, and tell your friends. I see Dr. LaReesa. Here she comes. She going to be in her office? She going to be from the hospital? Here she comes. This is the awkward silence. No scrubs. No scrubs. What's that song? No.
I still have my work polo.
Oh, your
So I
work.
have work polo day.
It's the elevated scrub look. I love it.
Yes. How you doing, Julie?
Oh, I'm good. Thank you for hopping
hmm
in, squeezing us in. I know you're hopping between things. I shouldn't say things, people today. So,
It is all good. It is all good. This is always a good departure, and having good dialogue with people outside in the what we call it the Menoverse, the menopause universe, the menopause ecosystem, which grows so much out of a typical doctor's office now. So
yeah,
it's still good to have these conversations,
I think
honestly.
so.
So thank you for having me.
Oh, always. We never tire of them on the Menowell campus, aka our Slack. Always something. Okay, so when I said, what are we gonna, or you said, what are we gonna talk about? And I'm like, I don't know, whatever excites you. And then you said, you just texted me ease and flow.
Oh, I
So
did.
to
I
me, that means
did.
progesterone. I'm just saying ease and flow, progesterone equals ease and flow. And I'm still a little
hmm
salty that I waited. It was so long before I heard the magic, the ease and flow of progesterone. So,
hmm Yeah, but you know now,
okay.
right?
I'm like,
What does Maya Angelou
girl,
do? When you know better, you do better, right? Those
right.
are words to live by,
Live
you know?
by. She is my bestie. I'm, right up there with maca and chicory root and then progesterone. Not necessarily in that order.
Yes.
Like if I go to bed and I forget because I wait to take her
Uh-huh.
until, I go to sleep because she helps me sleep. I have a little stash next to my
Uh-huh.
bed so I can just lean over and grab that.
Mm.
All
I
right.
like that you call her her.
Yes.
That's cute.
Yes.
Yeah, I like that.
Yes.
It's interesting because I have patients when they're not wanting to use vagina, clitoris, all those other magical like anatomical words like they're what we call them, right? And we might start using pronouns all of a sudden in a conversation, with her,
Right.
you know,
She.
she, so
Sometimes they. Yeah.
hey, whatever works, but
All
I
right.
like that. Are you
Sure.
taking
My husband,
magnesium too
you know
with
what?
that? Do you take
I still
magnesium at
have
night?
my note
Mm-hmm.
from our last call with my
Mm-hmm.
scribble that says magnesium threonate, right? And I need to
Three
throw
and
this
eight. Uh-huh.
post-it away,
Mm-hmm.
three and
Uh-huh.
eight, but I
Uh-huh.
didn't because I still have to get that. So it's a really bad little post-it too, but I saved it because I need to order it.
It's okay. It's okay. We're all on that journey, right? And tweaking what's good for you, because one of the main things that I start the conversation with patients or clients, or just when we're having these conversations, is that a personalized journey is what we're catering to.
Mm.
There are definitely some essential threads for all of us, but at the same time, we have to, kind of curtail what's going to be good, and also know where you're taking, because what I find even in my consultations with patients is I want to know everything that you're on, because in the world of Amazon supplementation, or, all the different things that are out there, you have to turn the bottle, because you really could be duplicating and paying more for something or on top of it, and it's not
Or
necessary.
taking
So,
too much of one thing.
yeah.
That's what I'm
Mm-hmm.
really sensitive around, because the milligrams, it seems like many supplements. That's why we're bullish. You and I are, as a company, we're bullish on supplements,
Mm-hmm.
and you have to be informed, because there are many out there that have these mega doses that we may
Mm-hmm.
or may not need.
Yeah. Absolutely. And also tracking, if you're going to start an intervention, understand why you did it and are you getting the outcomes? So it's part of what I use in even my 7 wheel of integrative wellness is, at some point you have to measure the KPI.
Mm-hmm.
Like, so is it doing the key performance or the index or what you've been following it's been intended to do? And after 3 months or so, you need to reevaluate, tweak, as you go, because you're going to find that special sauce. I'm using your thing, your special sauce that you need.
Right.
So yeah, all the
And
above.
that's the
Yes.
hard part. We don't always know. That's why I want to talk about progesterone,
Yeah,
and then we're
yeah,
going
yeah.
to come back, because there's
Yeah, yeah.
certain things that we take. Let's just,
Mm-hmm.
I'll just throw it out there, like omega-3s. We know we need omega-3s, but how do we really know that
Mm-hmm.
it's supporting our brain health and all that? I'll personalize it. I take it because I know it's one of those things that
Mm-hmm.
I need more of. I don't eat as much fish, salmon. I don't eat sardines. I don't eat the
Mm-hmm.
canned
Me
fishy
either.
thing. Tuna is as close as I'm getting to that. I don't want any
Me either.
eyeballs looking at me with any of that stuff. So
Yeah.
I supplement with omega-3s, but I don't always know, is it helping? But it's just what I do. So
Yeah.
same thing with D, right?
Mm-hmm.
D3, etc. So,
Mm-hmm.
all right, wait,
Yeah.
don't answer that. I
Okay.
want
No,
to talk
no.
about
Okay.
progesterone, because not that we're not advocating for hormone
Okay.
therapy. Do you, sister? But
Okay.
if you decide and you're thinking about it, this is something that I really want to amplify, that has been so beneficial, and it is a treatment that you can feel the impact. It's so protective, but there's a juicy little benefit in there that I don't think we talk
Mm-hmm.
about enough. Okay, handing it over to you, Dr. LaReesa. Tell us, what is progesterone? Why do we have to take it, etc.? And what do we get?
Yes. So progesterone, it is a hormone that in a reproductive woman, or someone using, or excuse me, in their menstruation cycles, or what you knew as your menstrual cycles, this is the potent hormone at the second half of your cycle that is highly produced after ovulation. So having supportive progesterone actually helps support an early pregnancy. Actually, it's the main hormone that keeps a pregnancy stabilized until the placenta takes over. So what happens to a lot of those roles and effects when they're so important on this range of reproductive health on the other third of your life where you're going to be spent? And it's so a lot of times, especially when you're doing hormone replacement therapy and you're adding estrogen specifically, if you have a uterus, progesterone is going to protect the uterus. So going back to what you use as the word protection, what we mean by that. If I like to call progesterone that police of estrogen, that protector of some of the effects of estrogen along with the uterus can do, which can cause irregular bleeding because it can destabilize the what we call the endometrial lining, or proliferate or grow the endometrial lining, which can make it more risk of badness. So things called abnormal cells that can become endometrial cancer. So we want to make sure that we're protecting the uterus if you're on especially estrogen therapy, all right, and you have a uterus intact. So that's what we talk about from the protective standpoint. So the other thing, so you talked about sleep. Many of the things that we're talking about as far as the juiciness of sleep is progesterone in some ways is considered that anti-inflammatory and that calmer. It has certain effects on what we call the GABA, or the calming effect of that neurochemical in our system. And so to be able to add that back most of the time, we would suggest to do it at bedtime because it's helping you relax, it's helping you get ready for sleep, and so therefore have a more steady sleep. Now, I'm not going to say it in the range of someone who might have a pathological issue with sleep patterns like sleep apnea or some other form of obstructive or inherent sleep um, a problem or disorder, because we don't want to say, just like with any prescription, that you just throw this at it and you'll do. But we're talking about specifically for, midlife menopausal women. You can find a good benefit of doing so if you know that sleep disruption or that nervousness, what we call that sympathetic drive throughout the day, and you need that calming, that parasympathetic calming effect on your nervous system to help you rest.
So we're not
So
waking
it's
up
very good
at 3 a.m.
having our executive
having our
business meeting that you didn't
board meeting
call,
that we didn't have
that we did call.
that we didn't call. You're just saying all my things today, aren't you? Oh,
I'm
that's
a
so
good
funny.
pupil, right? Like, we learn from each other, right?
Yes,
So this is,
beautiful
definitely
exchange.
a beautiful exchange. Absolutely. And then, I mean, you have progesterone cells everywhere within the body. So a lot of that anti-inflammatory, that relaxing effect is going to be profound. Even when we're talking about cognitive, even when we're talking about bone, like part of that structure of having that tandem of estrogen and progesterone throughout those reproductive years are still going to have some of those similar benefits, even more so in midlife as well. And it may be definitely, so let me do a follow-up question that I might be asked. So, I had a hysterectomy. Doesn't mean that I need to be on progesterone then? And so the answer is no. Many times progesterone still won't be prescribed because of elimination of that protecting effect. So going back to, if this is someone that is having some sleep disruptions, many women in this age bracket are driven by this sympathetic drive, high stress, anxiety, different things that I want to promote more relaxant things, then that can be a good option to add to it on a nightly dose. So I'm talking about the oral capsule version. Now, another common formulation is also through creams or something topical that can be used. So,
Are the creams as effective? Because I'm going to pretend like I know something now. Right, the size of the molecules, so they don't necessarily absorb in the same way as an oral micronized progesterone.
yes. And also in that same way too, how it's absorbed versus going through the gut and actually depending on some absorption from the gut, and knowing that it may not all be absorbed there. But I will say, observational wise and common practice, even beyond what I've been trained in, is that we often get a better effect of that sleepiness, that relaxing effect at night through the oral versus the topical version, and you get better uterine protection. So majority of the time, somebody's going to give you a capsule over a topical when you're using estrogen, because you have more studies that support the oral formulation of the micronized progesterone or the progestin, which is your synthetic component.
LaReesa, let me ask you really
Yes.
quick before you go on.
Yeah, sure.
So if you are perimenopausal and you're struggling with sleep, I remember back in the day, that was a huge part, the night sweats and all that. So not, I know, I don't think progesterone directly helps night sweats, but the sleep deprivation, back to when I was having babies, we know not getting sleep just impacts everything and amplifies brain fog, all the things that we're going through. So can a woman, so maybe her estrogen hasn't completely, gone down to the bottom of the Grand Canyon, but could she be prescribed progesterone back by itself during perimenopause to help with sleep and calming her body down?
Absolutely. So, a tidbit that I'm gonna put out there, a lot of women are surprised that I may start perimenopause women more on what we call cyclic progesterone before I give them estrogen. And especially if they've had history of heavy bleeding, fibroids, etc. getting a good clinical history can really identify well how much someone could have more dominant estrogen symptoms or more fluctuations. We've talked about before kind of like that catch mitten thing, meaning that we have receptors all through our body. And so even how we respond to different hormones may elicit different responses. I'm talking about especially Black women who have more pronounced incidence of fibroids or undiagnosed endometriosis or pelvic pain or issues, even into the spectrum of PCOS. And so those are areas where you want to be a little bit more sensitized in the perimenopausal period, that if this is someone not on contraception, where they're going to naturally get some form of estrogen and a progestin, or is different formulations there from single or adding, we're not going to go in that. So outside of that is if they're not going on a contraceptive formulation, which can be combined or monotherapy with just a progesterone, which can be done through IUDs, etc., then a consideration is to just put them on what I like to call cyclic progesterone, because oftentimes those peaks and valleys of the estrogen can oftentimes be policed or stabilized by giving them the right amount of progesterone. And so what I mean by cyclic is I might not be giving them that every day. It might be trying to mimic what they were doing in their cycles period, and where they're making progesterone on the second half of their cycle. And if that's the case, able to still be able to get a lot of symptom relief, cycle control, some more predictability, and mood stability, just by trying to mimic some of the natural rhythms of our body, because there's such, the age of chaos. This perimenopause period is starting to take so many names now, other than transition. It can be an area of chaos for a lot of women, where garnering even just a low progesterone, micronized progesterone therapy may definitely benefit for sure.
That's amazing. I think I missed out on this too, because I had a tubal ligation after I had Blake. So that was back in the end of my 30s. So I didn't have to take birth control. So I didn't go through that transition of birth control, perimenopause, blah, 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 that I know a lot of women are working their way through. But I meet women now who are taking estrogen and still cycling. They have a uterus and they're cycling progesterone. And so does it still, that cycling still apply?
Yes.
Okay, once you're taking estrogen, you're getting enough. I mean, we're not giving medical advice here, so speak to your own doctor about your situation. But the cycling still works once you're taking estrogen, if that's your choice.
Yes. If and just to make sure there's clarification, you're cycling with the progesterone and taking estrogen probably daily.
Yeah.
And there's different other like things where there's certain protocols that you may interchange with your doses of estrogen, similar to what a pill is going to do. So some people may be familiar with the 28-day pack, like, okay, I took my pill every day. But if you ever looked at your pill closely, you might have had 3 numbers or just 2 numbers on there. Because honestly, there's a way, or there are different pills out there where you might have had a switch in your formulation of a stable estrogen and then played around with increasing stepwise the progesterone, or both, so with that particular effect, it may, hormones at the same time could be complex or simple, because even then we're not testing levels for somebody who wants birth control. We're not, these are things that are used for people with PCOS, endometriosis, those who might have fibroids, for common gynecologic issues or problems, just to address bleeding. But going back to the ease of flow of progesterone, you still needed, in order to comfortably have that police of some of the estrogen effects, to have more of that relaxant component of some of the benefits that you're going to see with that. And even from the point of some of the side effects that people may have with estrogen, which some people may have more tendency of having headaches or feel like they may get a little bit more bloated, and just having that that level off with the progesterone too. So I think it's really good as far as having so many different effects of understanding that you have receptors pretty much everywhere
Mhm.
that are still going to respond to it. So it's definitely something to consider. And it's definitely something that you need to be on if you still have a uterus and you're starting HRT menopause with estrogen.
Yeah. Wow.
Mm-hmm.
This is why
Mm-hmm.
when we started talking about personalized
Mm-hmm.
medicines, personalized healthcare, whether that's supplements or hormone therapy, it's simple. Like you said, when I went on birth control pills in my 20s, it's just like, okay, here you go. Here's the pack. And they made my stomach hurt, so I want to give me a different one. Okay. All right, ride that out for 15 years. There was no testing of anything.
Mm-hmm.
It's just really interesting. So it's simple, but yet so not, right? And now we have all these tools to measure so much more,
Mm-hmm.
not to mention, watches and CGMs, continuous glucose. Like we're just like a walking lab with all these things.
EMFs,
So
that's what we are. Yeah, full of
yeah, it
EMFs.
feels
Like we have to
very
detox it from
complicated
it.
and
Mm-hmm.
confusing. So
It
that's
definitely can be. It definitely can be. And I think what you support a lot in this platform of things that we have talked about is we have to start the conversation and recognize that, okay, something's not right, or I want something different, or I was in here with a client, not trying to bring all the F bombs here, but she was like, sometimes you just want to know what the heck is wrong with your body, right? And I was like, yeah, that's exactly right.
right.
You're absolutely right.
Please
And
tell me.
but part of that is to not only find the right practitioner, but it's such an access of information out there that now it's become so confusing and trying to narrow it down. And so that's what I feel like the special sauce and a lot of things that I'm able to add to the equation is to, one, make sure you don't feel like it's all in your head. Two, educate. Like these moments of, okay, it still has a role. It still can, play a major role with your system, your body, not only from sleep, but from the relaxing standpoint, the anti-inflammatory components, from supporting bone health, hair, skin. I mean, all of those things are going to play a big modulator of even your immune system and your cardiovascular system. So no stone won't necessarily be unturned when you're even considering adding this into your regimen. So you're going to get additional benefits as well, other than just restorative sleep.
I'm all in. Okay, is there anything we need to
Proof
be
is in the
worried
pudding.
about with progesterone? I know I am. I'm like, okay.
um,
Um, yeah.
Actually, let me go through a couple of pearls of recent. So, and this is real time with a couple of questions that have come up. So we talked about formulations and approach. So there are only two formulations available commercial. So we're talking about your routine big box pharmacy. And so those are 100 and 200 milligrams. So a lot of people may complain about, well, I didn't do well on progesterone. It may cause a little bit of swelling or bloating, or fluid retention, or maybe you felt like you had a little bit more breakthrough spotting or bleeding. And to me, that's just pretty much a mixed match of how much estrogen you have in the system and how much progesterone, and kind of balance. So it may be a consideration where you need to formulate 150, 175, or maybe you do need to go up a little bit to 225 or just 50. Understand that that may need to be compounded now.
Because that's
So
not
don't
available right now.
commercially.
100
So
commercially and 200 milligrams of micronized progesterone we're
exactly,
talking about
is
here. Okay.
micronized progesterone is what
Mhm.
we're talking about. Exactly. And so I think that's important that people understand that, because it may come up that, hey, I had some issues or side effects, I can't do progesterone, where they probably just need to tweak the dosage or amount and get a
Mhm.
more customized dose before throwing it out the window completely. Um, and then another consideration is cream. So I tend to, someone who is menopausal and want to just use it topically. And you can also get those in pellets as well. I am going to favor on the side of definitely giving you a capsule when you're on estrogen therapy, because I know studies are going to support more uterine protection with the capsule formulation. If sometimes if you feel like you're getting too much, I mean, look for skin breakouts, getting difficulty with digestion, or bloating, or just feeling, fluid retention might be some of the bigger ones. But honestly, it tends to be very well tolerated. I will say this is just observational wise, and for women that I deal with in the reproductive realm who do not want to be on birth control or synthetic or whatever, I will trial them on either regular cycling of progesterone or even the topical. Because in those particular standpoints, we may get a better cycle control or just better symptom control. So it just kind of depends. I guess the main thing that I wanted to understand that there's other options or different ways that you could potentially be able to do it, and not feel like you're just kind of stuck with that 100 or 200 milligram capsule dose based on your treatment regimen.
Yeah.
So just kind of highlighting that a little bit.
You know what I'm
Mm-hmm.
really, my takeaway is, and
Mm-hmm.
more, I love progesterone. She's like my little
Yeah,
friend.
no, really?
I
You
do
do?
love her.
Really? Okay.
But starting to sound like a
We
weirdo.
started there. We started
I
there, but
know. I just
that's
can't
your
help it.
she or her.
She
Sorry.
is
That's your her.
my new bestie. But LaReesa, I'm just going to say the bigger takeaway in this conversation is to find a doctor like you. Find a doctor who is willing to go all in on what works for your individual situation, because we do have the ability to have personalized medicine now.
Mm-hmm.
If you find a doctor that will spend enough time with you, care enough to take you through, like, oh no, not just here's your 100, here's your
Mm-hmm.
200 milligrams. Oh, you don't like it? Not working for you? Okay, off that. Versus,
Mm-hmm.
oh, maybe you need this nuance. That is a beautiful gift that you're bringing to women in all the stages. I know you, all women, but especially through the stages of menopause, because as
Mm-hmm.
you know, most women don't have that. They don't have that.
No, they don't. And I
Yeah.
feel fortunate, because one, I did my own journey. I'm perimenopausing, right?
Ink,
Um,
yes.
but I'm also speaking from someone that I had severe endometriosis. I did have a hysterectomy, almost 3 years ago now. And I knew, even if at this point I'm not flushing, I've done some tests, I kind of know exactly where I am. But one of my biggest things, or even then, going through some of the painful episodes of periods, etc., was I was having sleep deficiencies. I was, starting to get easy with, burnout or just skin breakouts or any of those type of things. But it's so interesting that no matter what, once I started taking care of going through, your own personalized journey, getting that right recipe, I just think it's interesting that I mean, I sleep better beyond, other things like a 2-year-old or something
I
in the
was going to
home,
say,
but,
baby.
but less stressed. I remember feeling that stress going into a cycle or coming off of a cycle. And that's the thing. I had exhausted everything at that point, and I had done well with certain measures, or from micronized progesterone to considering contraceptives and some other things. And at some point, you make a decision that's going to be best for you. And I think that's really important that I reiterate that, because I was one of those, hands up, I'm dying with all my female organs. Yes, I'm a gynecologist and all that, but that's how it is. But oftentimes, just in making those decisions, it depends on the spectrum of symptoms that you're experiencing. And it comes down to the quality of life. I don't want to stress that more. This is a time where we're not only talking about Women's Health Month awareness, but here on my Meno is 365. I'm gonna put that out there for you. Yeah. And then and then on top of it too, it's mental health awareness. And I know you had just had a good, healthy conversation about that on Tuesday as well. And all of those things factor into what someone may be looking for with considering progesterone
Right.
therapy. But understanding that it's if you need an addition or more, that you're going to make sure that the strategy entails that you're improving in your quality of life and that you're able to function and not feel like you're just going through the motions and normalizing too much.
Wow.
And it's a lot of that out there.
So much.
So we don't want to do that.
That's why
Menopause.
they need to follow you right here
Yes.
on Instagram. Check you out. You're in Florida, but you do telemed also to have that personalized level of care. I could talk
Yes.
about my girlfriend progesterone for a long time with you, but I may have
We're going to
shared,
go.
maybe some of you saw, I am back in business school and I have a meeting with my advisor right now. Like, what the heck was I thinking? But anyway, I can't
I'm
multitask.
loving it. I can't wait to hear the other side of
Hashtag
this. This is going to be good. But
you're
this has
not
been
too
good ease and
happy
flow.
with it. Yes. Okay. Follow
All right.
Dr. LaReesa. I got
Yeah.
to go with my advisor.
All right.
Okay.
Good luck to
Not to
you,
be a
Julie.
progesterone pusher, but I kind of am. Okay.
It's your
Take
her.
care.
All right. Bye.
Be well, everybody. Talk to you soon. Thank you, doctor.